Hello and welcome to the final video in the Difficult Counseling Situations video series. The title of this Level 4 video is Supporting Mothers Facing Difficult Situations. In this video, we will look at ways WIC-designated breastfeeding experts, or DBEs, can use good counseling skills when helping mothers with complex breastfeeding problems. When following up on referrals for complex problems, consider the mother's capacity for being able to address that problem. The transition to parenthood is an especially vulnerable time for mental health. One study found that between 9 to 21% of women experience depression, anxiety, stress, low self-esteem, and lack of confidence in the early postpartum period. How a mother feels about herself, which is called her self-efficacy, can affect her ultimate feeding decisions. New mothers might experience a wide range of emotions. They might be frustrated, anxious, or fatigued. They might have low self-esteem or even feel that they're a failure. When mothers experience problems, they often blame themselves. This diminishes their self-esteem even further. Because of their health and mental status, they may have trouble concentrating or focusing on solutions. They may be unable to visualize the impact of current decisions on long-term outcomes. Let's watch a video titled Breastfeeding Challenges. Listen to some of the early challenges and feelings that new mothers face. Make a note of positive counseling approaches that can help mothers continue to breastfeed even when they are facing more complex problems.
It's not easy to breastfeed, but it's not impossible. And I always tell mom, if you can have a baby, you can breastfeed.
They want to breastfeed, they want the best for their baby, okay? When breastfeeding is not going well, they feel like a failure.
In the beginning, I was frustrated at first because it felt like my supply wasn't coming through and I was getting frustrated. At one point, I felt like I wanted to give up.
It was very painful, partially because my baby, when he was born, was tongue-tied. It's something that thankfully has been corrected on its own, but it was very painful to the point where I didn't know if I was going to be able to continue on.
When we have the mom that comes in and her breasts, she's engorged, and we do that warm compress with her and try to help her, a lot of times we're able to solve the problem.
Sometimes returning to work can be a big fear for moms.
Finding finances or an income that will allow you to breastfeed your baby and work, it's been a challenge.
So when I'm with the mom, she has to feel that there's hope. So I'm not going to point out the problem, I'm going to point out the solution.
My natural approach is always to let them know that I remember feeling that way. And so now I've brought it to, like, you're not alone. I went through that too. And accepting their feelings. So if they're telling me, like, I'm tired, I'm overwhelmed, maybe I'm not getting help at home. So I'll let them know, like, it's normal to feel that way after having a baby, and then just break it down one thing at a time.
They told me to, keep at it, keep going, and then eventually I just kept going and I'm still going.
We had one participant, I remember, I think she developed mastitis. So that was beyond, so we had to refer her. When she got help and her problem was resolved, which was good.
WIC has been actually helpful in my breastfeeding process. They have a lactation consultant here who gave me some helpful ideas about the pain, so it's better now.
This video gave some excellent examples of ways to affirm a mother who's experiencing complex problems. Active listening can help lower a mother's perceived stress and help her to verbalize feelings. Be patient when a mother's frustrated. Let her know her feelings are normal. You might say, "It sounds as though you're frustrated that things are not going the way you planned. I can tell how much you love your baby. Your baby is lucky to have a mom working so hard to resolve these problems." You seem very overwhelmed with all you're experiencing right now. Most moms imagine things will go much easier. The DBE uses assessment skills to find out the cause of a mother's problem. The breastfeeding assessment videos give much more information about how to conduct an appropriate breastfeeding assessment. Engage the mother in the process. Reassure her that problems do have solutions and she's not alone. Together you can come up with solutions that will work for her. When sharing education, remember a few pointers. First of all, offer solutions that are simple and easy to achieve. If the problem is complex and will take a long time to resolve, it can be empowering for moms to experience small victories along the way. You can use visuals to help the mother understand. This can also help her visualize success and build her confidence. Share options and allow the mother to choose what she feels will work best. This helps her to gain a sense of control. Finally, demonstrate the solution for her. Better yet, allow her to demonstrate the solution. This will help build her confidence as she tries it out on her own. As a DBE, you may occasionally receive referrals of mothers with a history of sexual abuse who want to breastfeed. Be sensitive and listen to help build trust. Women who have been abused may be in a fragile emotional state and need a lot of support. For some women, breastfeeding can trigger memories of abuse and affect their feeding decisions. Women who have been abused are also more likely to experience complex problems such as mastitis and breast pain. If the mother's uncomfortable putting her baby directly to her breast, help her with exclusive pumping if that is her choice. Follow her closely to be sure pumping is going well and she's able to maintain her milk production. According to the CDC, 1 out of every 4 women have experienced domestic violence. This is also called intimate partner abuse. Women experiencing abuse are at a higher risk for depression, smoking, and alcohol use. One systematic review found that domestic violence increases the risk of inadequate feeding practices and discontinuing breastfeeding. The DBE can support the mother in several ways. One way is to help her with exclusively pumping if she is not comfortable putting her baby to the breast. Praise even her small accomplishments toward reaching her goals. Point out what a great mother she is. And finally, of course, make appropriate referrals following your state or agency guidelines. This ends the Level 4 video on supporting mothers in the difficult counseling situations video series. Please take a few moments now to pull out your WIC Action Journal and turn to the Difficult Counseling Situations page. Write down something you did not know or maybe had not thought about. You can also write down at least one goal for something you will do with what you have learned. Please complete the Level 4 post-test for this video on supporting mothers. Once you have completed the post-tests and handouts for this video series, be sure to turn them all in to your supervisor.